Everybody. Thank you so much, Anne, and thank you, Kathy and Emily, for organizing today's session. Center for Mental Health, we are a research charity with a special interest in mental health inequalities. So I was asked today to share my reflections on why we should bother with research in this area and how can it help us make a difference. At Center for Mental Health, one of our key aims is to bridge the gap between research, policy, and practice. We've known for a really long time that racism profoundly and negatively impacts mental health and that it exists within the mental health system, both within the NHS and outside of it. Nearly 20 years ago, we published a study called Breaking the Circles of Fear, which highlighted injustices Black people and minority ethnic people faced within mental health services. And at the time, we made several recommendations. The sad reality is much of what we found then continues to be an issue today. More recently, we also ran a 2-year commission for equality into mental health across all ages, where we analysed evidence looking at the determinants of poor mental health, access to support, and what outcomes they achieve. And we found ongoing sort of inequalities there, especially around racial disparities, despite this being highlighted in numerous reports over the last 40 years. Um, these inequalities still persist. So we published a final report called Mental Health for All, and I can share links to the reports I mentioned at the end. In relation to children and young people who might be impacted by racism, the evidence can sometimes paint a pretty confusing picture. For example, we know that at age 11, young Black boys are not much more likely to be identified with a diagnosable mental health condition. So why is it by the time that they become adults, they are much more likely to be identified as being in mental health crisis or that they are overrepresented in restrictive mental health settings? We know that ethnicity in itself is not a risk factor for poor mental health. So we really need to better understand how racism itself might be an explanatory factor. We've been evaluating a program called Shifting the Dial, seeking to reverse this trend, and hopefully we'll have some findings coming out from that in the next few months. I also wanted to say that it's not all doom and gloom. Research can actually lead to tangible change and make a difference to people's lives. So, for example, the current reform and modernization of the Mental Health Act is a result of mounting evidence on the disproportionate use against people from racialized backgrounds. There are also lots of fantastic initiatives out there working to support children and young people impacted by racism and discrimination, but not all of them are properly researched or evaluated, and therefore they're not considered evidence-based and not sufficiently resourced as a consequence of that. I really wanted to stress the urgency of prioritizing research in this area and why we can't wait. We know that years of austerity, Brexit, and now the pandemic have really magnified racial disparities in the UK. Some of the effects we're starting to see now, and some we won't know for some time. So, what approach should we take to research? I think it's really important to not assume that knowledge doesn't exist. There's lots of really rich insight and evidence within communities which is not being recognized or responded to. I think it's really, really important that we plan and design research programs with sufficient time and resource. These are underserved groups that we're talking about, but they're not the ones that are hard to reach. It's important that researchers create meaningful opportunities to engage children and young people from racialized backgrounds in studies, and also partner with community groups who already have existing and well-established relationships. I just wanted to share a couple of research priority areas that's coming out through our work. We know that racial discrimination in education can lead to all sorts of problems for young people. For example, poor attainment, which is likely to widen now because of the pandemic. We know that school exclusions, there's a disproportionate level against young Black people. And all of this kind of leads to poor mental health outcomes. We know racism, unemployment is also a really interesting area and impacts on young people's well-being and mental health. Racial trauma, this is a really interesting area where there's growing evidence base in the US, but not that much within the UK or its impact on children. And I just wanted to share a couple of principles that I apply in some anti-racism training campaigning that I do outside of work. of honesty, hope, and humility. And I really think it really resonates with, my thinking around how we should pursue research in this area. So honesty in that research for far too long has kind of overlooked racism and mental health and has been under-resourced. Humility that actually there really isn't a perfect solution or approach to address all of these challenges that we're talking about, and hope that hopefully with collective will and commitment, we can promote research that will improve outcomes for children and young people. So thank you for your time, and I look forward to hearing from you all later on.